But in the meantime, it has been a very long road for people who've been campaigning for the right to use medicinal cannabis. But their campaign has taken a huge leap forward with the announcement that Tasmanians will have access to the drug from the 1st of September. Let's have a listen to Health Minister Michael Ferguson speaking to Sarah Gilman on Mornings yesterday.
We recognise that this has been a difficult issue for a lot of families in Tasmania, particularly those looking after loved ones, young children especially, with drug-resistant forms of epilepsy. And we also understand that there's been a lot said in the public space about the potential benefits of cannabis products. But we've wanted to be very responsible with how we do this. We want to make sure that patients are not being exposed to unsafe drugs, knowing that there is still limited evidence for medical cannabis products. But doctors are strongly supporting a medically supported scheme, and the scheme will be open for applications from September 1 of this year.
Health Minister Michael Ferguson speaking with Sarah Gilman on Statewide Mornings yesterday. The state government will introduce a controlled access scheme. Now, this means patients can be prescribed with unregistered medical cannabis by a specialist doctor, and there will be $3.75 million in the state budget tomorrow to facilitate assessing patients with severe epilepsy who could benefit from taking cannabidiol, which is the name that's going to be given to it. Lynn Cleaver's been advocating for medicinal cannabis for some time now, and she joins us this morning. Lynn, good morning.
Good morning. How are you?
Very well. You must be pleased with the announcement.
Yeah, it's a good step forward. It is very restrictive, but hopefully we'll see some children with pediatric epilepsy find some relief.
When you say restrictive, who exactly is going to be able to have access to this scheme?
And it does appear that the first focus will be pediatric epilepsy, which is really important. You know, those kids need, some help and relief, so hopefully cannabis will provide that. But our concern is that it's so restrictive. We've got people the majority of people that we speak to either have chronic pain or cancer, and they've all sort of just been left outside of this controlled access scheme at the moment. So that's a concern.
Are you aware of plans to take it step by step and see if the scheme can be expanded in the future?
Well, I would hope so. But when the controlled access scheme was released initially, the government was very proud of the fact that it would be a broad patient group, unlike Victoria, who were just targeting pediatric epilepsy, and it seems the government has done much the same thing. So there'll be a lot of people in Tasmania that will have to wait a little while longer for illegal access to cannabis.
The process laid out by the Health Minister is that you need to go to a doctor first, then get a referral to a specialist like a neurologist. Are you happy with that process?
Yeah, well, that's mainly, most children with pediatric epilepsy would be followed by a pediatric neurologist. The concern is that, I know for our experience with adult neurology, our son's on a waiting list at the moment that stands at 12 months just for an appointment. So that's a long time to wait for people to actually get into a neurologist to get a script for cannabis.
I mean, you have to consider that there would be risks with unregistered drugs. So healthcare specialists have to have a process in place to manage, to monitor those risks. So would you agree it's important that specialists consider patient safety and how appropriate medicinal cannabis is for the individual?
Oh, absolutely. It's the same for any drug. Anticonvulsant drugs are not tested on children either, so that that's an unregistered process as well, because they're not tested on children. So, children with such a chronic condition should be followed closely by a neurologist. In our experience, and most of the people that we speak to, they find that cannabis is by far the safest therapy that they've ever offered their children or used themselves. So that, I guess, that's something that has to be proven over time to our doctors and to our government.
Let's have a listen to what the Minister said yesterday about access to prescriptions.
Until such time in Australia where there is a registered product that comes onto the usual drug market, just like any other drug that has to go through extensive testing, until that happens, our controlled access scheme will remove barriers that exist for Tasmanian patients for whom there may well be a benefit. What's
your thoughts there, Lynn?
Well, he's right. You know, it's a process, but the issue is there's so many Tasmanians already using cannabis and there's been no provision made for them. You know, we're not seeing an increase in patients landing in hospital overdose from cannabis because it just doesn't happen. So it would have been nice to have seen some provision, even, you know, like doctors being able to do patient studies on Tasmanians already using cannabis so they can follow them, you know, and do blood tests and EEGs and all those sorts of things that will happen anyway under the Controlled Access Scheme. I think he's being rather careful. I understand why he's being careful, but he's forgetting a whole heap of Tasmanians that are already doing this quite safely.
What other reforms would you like to see?
I really think there should have been provision made for those of us already using cannabis. Most of us are very happy we've found the strains and cultivars that work best for our loved ones or ourselves. And to be honest with you, I'm not sure that they will switch. The cost of these medicines that Minister Ferguson is talking about can run into thousands of dollars per month. So I really can't imagine that many Tasmanians will be able to afford that, and that's a concern.
Lynn Cleaver, thank you very much for joining us this morning.
No, thanks, Belinda.
On ABC Northern Tasmania, Lynn Cleaver, an advocate for medicinal cannabis. The government says if you're interested and think you or your child might meet the criteria for prescription under the Controlled Access Scheme, you should speak with your GP when the scheme opens. And the announced opening of the Tasmania Controlled Access Scheme follows Tasmanian Alkaloids entering into a partnership with Ozcan, which will see medicinal cannabis also produced in Tasmania, subject to satisfactory licence approvals. It's 18 minutes past 7 on ABC Northern Tasmania.